Earlier this week, FYI talked with a local pediatrician about the suspected case of mumps found at the Drums Elementary Middle School. Lisa Sugart sat down with Dr. James Caggiano to get answers to your questions.
We've told you about the one suspected case of mumps in the Hazleton Area School District. Well, now we're talking with a local pediatrician to find out what mumps is all about and what you should know to stay safe. I'm pleased to be joined by Dr. James Caggiano, who is a pediatrician with the Lehigh Valley Health Network. Dr. Caggiano, first of all, what does a suspected case of mumps mean?
A suspected case of anything by the CDC definition means that the information that's presented to the physician when he or she examines the patient suggests that diagnosis. Okay, so when a doctor says, this is my clinical suspicion, it means based on what I heard from the patient, what I found on physical examination, this is what I think is going on. Now, if the laboratory data doesn't support that diagnosis, but the physical examination findings are consistent, then by the CDC definition, it's a suspected case.
Okay. Now, for anyone who is worrying about this, what are the symptoms of mumps?
Mumps is a paramyxovirus that's spread by droplet spray, so sneezes and nasal secretions, and the symptoms are pretty nonspecific. Fever, body aches, that sort of respiratory symptom. The cardinal symptom, the thing that everybody looks for, of course, is the chipmunk cheek thing that kids get, and what's actually physically happening is the parotid salivary gland, which kind of sits in front of the ear and kind of has a little piece that wraps around behind the ear, gets swollen, okay? In mumps, one side can be swollen or both sides can be swollen. The issue, though, is that there are a lot of other viruses, some pretty prevalent at various times of the year, that can cause the same kind of clinical picture. So parainfluenza virus can do this. Influenza A can do this. Coxsackie virus can do it. There are some really oddball viruses that can do it. A blockage in the tube that allows that saliva to be drained into the mouth can make the salivary gland get bigger. It's a very common problem in elderly patients, for example, who get dehydrated. Okay, so it's not always infectious. So in this case, the issue is, how do you discern whether this is the tip of a very much bigger iceberg with more to come, or just a sporadic case? And as sophisticated as the laboratory testing is, the CDC tells us that it's not, completely foolproof in real time. You can make the diagnosis after the fact as you gather more information and see how that patient's immune response mounts itself. But in real time, there's very little that you can do to say that this is definitely a case of mumps parotitis as opposed to parainfluenza parotitis. And so, since mumps is a reportable illness, once that clinical diagnosis is made, it gets reported to the Department of Health. They apply the CDC guidelines, and very appropriately, they said this was a suspected case. And so that triggers a whole series of precautionary measures, including the exclusion of the index case, the patient, from school, and exclusion of any other person who is susceptible to the illness from that environment. So in this case, when parents have opted not to immunize their children against mumps for whatever reason, that kid's out of school for 28 days. It's a big chunk of learning at risk.
And you said this is no way considered an outbreak unless you have more than one case, right?
Right. You can't call it an outbreak if there's only one.
Okay. Right. So parents who are watching this and, may have been concerned when they first heard that, should they be worried in any way, shape, or form?
If your kid's been immunized, you've got nothing to worry about at all. The school district did take the precaution of getting this youngster out of school. The problem is that there is a time period before the patient develops their swelling, that they're actively shedding the virus. That's what we're all concerned about. As time passes, the clock is ticking, and the likelihood that we're going to see more cases gets less and less. I mean, I think that at this point, you just have to be aware of what the symptoms look like. Basically, what happens is if the youngster develops any kind of facial swelling, then you got to get them to see someone who can make the diagnosis for you. Hopefully your child's personal physician. But the other part of this is there isn't any treatment for this. The problem is there are complications. 7 or 8 or 9 days after a person gets the mumps, if you're post-pubertal, if you're an adolescent or older, you can get orchitis. There are, and in rare cases, folks can get an encephalitis from mumps. That's why we try so very hard to decide, is this really mumps, or is this another one of these look-alike viruses that doesn't cause any of those other side effects?
Lastly, do you think maybe this is a wake-up call for some parents that it will at least put immunizations in a positive light?
I would hope that it would. I mean, immunization is the innovation of the last and this century going forward that's going to make the biggest impact on the infectious part of what we do. And it's in part why the character of primary care in this country is so different from the way it was 50 years ago. We don't see these illnesses in part because of the immunization programs in this country, so that we would hope that people would be more attuned to taking advantage of this very, very, very important public health intervention.
Dr. Caggiano, thank you so much for giving us some important information on mumps.
My pleasure.
Thank you, Lisa.